Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, I'm Ardian Tiorini. You can call me Dia. I'm student of Medical Record Study Program in Polytechnic Negeri Jember, and I'm so excited because this is my first video and I want to explain about Mycobacterium leprae. Mycobacterium leprae is an aerobic bacillus surrounded by the characteristic waxy coating unique to Mycobacteria. It is an intercellular pleomorphic acid-fast pathogenic bacterium. Mycobacterium leprae is a rod-shaped bacterium with a size of 1-8 microns in length and 0.2 to 0.5 microns in diameter. It has two types based on form. The one form is tuberculate, which induces a cell-mediated response that limits its growth. And the second form is the lepromatous form, which grows within the epithelial tissues of the face and earlobes. Mycobacterium leprae causes a disease called leprosy. It is also known as Hansen disease. Leprosy is a chronic granulomatous disease affecting the skin and the peripheral nerves with lesions preferentially occurring in cooler areas. These are the extremities and the upper respiratory tract. Leprosy is difficult to detect in the early stages of the disease because Mycobacterium leprae multiplies very slowly. It divides approximately once every 13 days. Most people who have leprosy do not develop symptoms for at least a year being infected by the bacteria. In most cases, incubation period of the leprosy is about 5 years, and the symptoms can take as long as 20 years to appear. The symptoms of leprosy include muscle weakness, numbness of the hands, arms, feet, legs, and skin lesions, which result in decreased sensation to touch, temperature, or pain, and they don't heal even after several weeks. It's thought that the leprosy spreads through contact with mucosal secretion of a person with the infection or when they sneeze or cough. The disease is not highly contagious. In Indonesia, the leprosy prevalence rate is 6.08 cases per 100,000 population with a total of 15,920 cases. If leprosy is not treated, it can cause severe disfigurement and significant disability. The treatment of leprosy by consuming several antibiotics and anti-inflammatory medications such as rifampin, minocycline, and aspirin. The treatment will last for months and possibly up to 1 to 2 years. Based on that, we know that there will be a lot of money and time wasted if we get leprosy. So how to prevent the leprosy or protect ourselves from Mycobacterium leprae? Don't worry, there are some ways to prevent the leprosy or Mycobacterium leprae infections. The first prevention is to avoid long-term or close contact with untreated person who has the infection. Prevention of contact with droplets from nasal and other secretion from patients with untreated Mycobacterium leprae infection is currently the most effective way to avoid leprosy. That's for our common good. And the last one, don't forget to wash your hand often because it's the best way by killing Mycobacterium leprae or other bacteria that causes the disease. So yeah, let's maintain personal hygiene and the environment so that we are always healthy and protected from viruses or other bacteria. I think that's enough for me, and finally we know some things about Mycobacterium leprae. Thank you for watching and see you next time. Assalamualaikum warahmatullahi wabarakatuh.